Thank you very much, Madam Deputy Speaker. I draw the House's attention to my interests, which are set out in the register, and also to the fact that my wife is an NHS GP and has been for the last 30 years. Madam Deputy Speaker, I rise to support my right honourable friend's Amendment 10, which seems to me to be absolutely right, and I can't really understand why the Minister, who's an extremely good Minister, isn't obliging the Government to accept it and accept it in full. And it's clear, Madam Deputy Speaker, as well, from what is being said across the House, that my right honourable friend has achieved an unexpected unity. And I say to him that even brilliant junior hospital doctors who in the past have marched against some of his policies are foursquare behind what he is saying today, and indeed foursquare behind the work that his committee is carrying out so brilliantly. I just want to make 3 points, Madam Deputy Speaker, about why the House and indeed the Government would be wise to support my right honourable friend's amendment today. The first is that, for reasons that he has set out eloquently, as has the Honourable Lady who speaks on these matters for the SNP, is that burnout in the National Health Service is an incredibly serious issue. The need for us to project how many we're going to need in all the different disciplines in the health service has never been greater, and the workforce requirements have never been more uncertain. And the cost of that uncertainty, as has been so eloquently set out, is paid in locums, with all the difficulties and downsides that have been mentioned. And I want to quote a note I've had from Dr. Raoul Dubb, who is the senior lead doctor in Royal Sutton Coldfield. He successfully led the rollout of the vaccinations in our town hall. He's extremely experienced, and he says this, Madam Deputy Speaker: a greater understanding is needed as to why doctors are leaving the profession. It's clearly multifactorial across the generations. One of the reasons includes pension rules. These penalise staff wanting to work more hours due to capped taxation rules, deterring senior staff from staying, and may lead to a significant exodus from the profession. In these circumstances, it is essential that far more effort is put into projecting future workforce numbers and how many are required to meet future need. And in my judgment, Dr. Raoul Dubb is absolutely right in what he is saying. The second reason is that the Government should listen carefully to what my right honourable friend has said. During his time as Health Secretary, and I submit there's probably no one in the House who has been so long at the crease and has so much experience as him, he did increase significantly the number of doctors who will be trained. We were particularly pleased in Birmingham to see the additional work that Aston University has been able to do to bring those who might have felt themselves excluded from the medical profession into contention so that they could go to university and achieve their ambition of qualifying as medics. And it seems to me that having that sort of analysis, having the analysis that is behind his amendment, is absolutely right in securing value for money. And I have been dismayed, Madam Deputy Speaker, that when we had the measures to increase national insurance earlier this year, greatly to the credit of the Government for grasping a nettle that so many have not grasped before, it struck me that the Treasury bench was extraordinarily disinterested in checking that value for money for this additional taxpayer spend was achieved. And when I suggested that we should account to our constituents through the Treasury, making certain that we understood where this £1.2 billion was going, the answer from the Treasury bench was extremely lacklustre. So value for money, ensuring that we get these judgments right, will save money, and for the reasons that have been set out, make medicine and the treatment of our constituents that much safer. And the whole sector is united, as my right honourable friend set out, behind this amendment, and the Government should hear that loud and clear. And the third and final reason why I have every intention of supporting my right honourable friend in the lobbies this afternoon, and urge my honourable and right honourable friends to do likewise, is this. We have in this country for far too long been pinching doctors from the developing world to make up for the shortfall that my right honourable friend is seeking to address. And long-term planning is vital to stop this. And it seems to me it is grossly irresponsible of this country to pinch doctors from the developing world at any stage, but particularly in the aftermath of a global pandemic. And yet that is one of the things we continue to do, and it is, in my view, an abrogation of British international leadership to act in that way. I remind the House that it wasn't so long ago there were more doctors trained in Sierra Leone practicing medicine in Chicago than were practicing it in Sierra Leone. And that is something which we cannot ignore. So for all three of those reasons, Madam Deputy Speaker, I urge the House to support my right honourable friend and Amendment 10 this afternoon.